always say the same thing, but this one reminds me of Connie and Tina.
From what?
She was like 16.
You used to hang out with them.
Remember? Yeah, we would spend the summers like,
No, but I mean, you were like in the car and
oh yeah. They would take us to go do things like go-karts. And they would take us to the movies. And, you know, we were the little cousins. It was really fun.
you were on this phone. It could be just really good day.
Yeah, super easy. Super easy for patients to do.
Yeah, I think that's gonna be really chill. Hello, Facebook, and we are now officially live. I want to introduce myself. My name is Dr. John A. Robinson,
And I'm Christina Bosch.
and we're the Sex Docs. This is our first official live Facebook Live event. We're going to be talking about a lot of great things today, giving an introduction about what it is that we do. But let me start off by saying, again, my name is Dr. John Robinson. I'm a board-certified naturopathic medical doctor. And since 2006, we really both have been focusing on hormone replacement therapy, anti-aging or longevity medicine, and helping people with their sexual health.
Right, so that gives you a combined, 20-some years of expertise, specifically focusing on hormone replacement and really taking that expertise of hormones and driving it towards the avenue of sex, which is ultimately one of our favorite topics.
For sure today. Aside from sex, we're going to talk about a lot of things just about the hormone zone. So the name of our practice is the Hormone Zone. We're located here in Scottsdale, Arizona. Beautiful Scottsdale,
Sunny
Arizona.
Scottsdale.
Sunny Scottsdale. And we're going to talk about what the Hormone Zone is about and what we offer here at the Hormone Zone. And then inevitably that's going to kind of lead into a lot of excellent episodes that we're going to have every week at 12:30 Arizona time every Tuesday.
Join us live every Tuesday. Just as a reminder, we don't change the clocks here in Arizona, so when you're tracking us, you're tracking mountain time, right? Mountain time.
Mountain time,
Yeah.
right? Or just Arizona time. We're the only ones that are smart enough not to change the clocks. I think.
So we
Anyway,
say.
and also we wanted to remind everyone to definitely sign up for notifications with our Hormone Zone page. We've got a lot of great information on the Hormone Zone page as well about health and hormones. So make sure you sign up for the notifications so you know when we're going live every Tuesday at 12:30. So,
And I wanted to say, this is a great time for you to get those sexual health questions answered. We would love to be a guide, an assistant here in your health journey, especially when it relates back to your sexual health.
yeah, and I think where that always starts is with hormone balance, and we're going to be getting into that a little bit today and again in the future. So part of that sexual health is to have hormonal balance first and foremost, and then we go from there, and there's all kinds of great things to continue to enhance that whole process for people. So let's start talking a little bit about what some of the topics are here today. But before we do, so let me ask you as we're starting, what does it mean to you to be sexy?
Sexy? Well, there's a lot of wonderful cliches that come to mind when we think what makes a person sexy, and it's definitely true that confidence and a good sense of self and self-love and optimization of self, which you'll hear us use that phrase quite a bit. I think that's one of the key importance to feeling sexy within ourselves, and then an easy way to emote that sexual energy towards our partners or just towards the world around us. So some of those key words for me are going to be confidence, health conscious, joyful, open, people who really have a fervor for life, who are able to just maximize their day-to-day and just enjoy living. I find that to be the sexiest.
Yeah. I think with men, they're looking for a sense of purpose. They're looking for a sense of motivation. And I think that's where they feel a lot of their sexual selves, their sexual power coming out of that. And that's why I think testosterone replacement therapy, when men need it, or any kind of hormone replacement therapy for men, it winds up being that foundation to where they feel, potent again.
Yes.
And
vitality.
That verve that you were saying. And I think that starts to make that connection.
This is a great place for us to kind of indulge some of our stereotypes here. So I'd like to take this moment to say these are generalizations. These are general theories and philosophies that have to do with sexuality. They are not the absolute rules for everyone. So this is where the conversation component becomes really exciting. We always like to know what those exceptions are. And keeping in mind that notion of being open, one of the things that we definitely are very open to our philosophies being challenged, as that's one of the ways we grow as well.
Absolutely. We don't want to be a victim of our hypothesis no matter what. A phrase that I've learned from Christina over the years. So we're open at all times about how we're approaching health for people. There's a lot of different ways to get there.
Yeah.
So let's talk about what some of those ways would be and what we offer here at the Hormone Zone. So first and foremost, it's sex hormone balance. Sex hormones, when we're saying sex hormones, it means sex. We're talking a lot about that today, of course. Yeah. But we're also talking about gender. It's what that sort of means. Male hormones, female hormones, and we want to balance that out. There's a lot of great ways to do that. One of the key ways that we both do and practice is something called subcutaneous pellets. And this is probably one of the most profound ways to put hormone into the system, keeping the levels very consistent. So they're small little pellets. In fact, I've got a couple right here on my desk. It's kind of hard to see, but these are tiny little pellets inside these little vials.
Kind of like a Tic Tac.
Yeah, like little Tic Tacs. And we just numb a little area on the side of the hip, place them very gently underneath the skin, and they'll just secrete hormone consistently for 3 to 6 months. So it's a really profound way to put hormone in the system, and these are natural and bioidentical ways of doing it. Bioidentical just meaning a hormone that's the exact same shape as the hormone that's normal to your body.
And what's wonderful about this therapy, especially for people like myself that have compliance problems, is that you don't have to remember to take anything. You don't have to remember to take anything. It's a minor surgical procedure that gets implanted as Dr. Robinson said, just underneath the skin. So it's literally there at your body's disposal as needed. And during times of intimacy or during times maybe where you need a little bit more a draw of those sex hormones, the blood will flow over those pellets, delicately taking what you need.
Yeah. And it's been around since the 1930s, so nothing new about it. There's some kind of cutting-edge ways that we're working with it, but it's a therapy that's tried, true, and tested. So, and that's for both men and women, by the way. Some of the other ways that we deal with, particularly for men, is testosterone injections. So this is another great way to put hormone in the system. Sometimes pellets are not the best choice depending on the patient and what they need, and injections tend to be an excellent way, particularly the way we do it here at the Hormone Zone. It's a little different than what you might normally see. We're doing injections that are actually subcutaneous, so it's a small little needle that's placed into the fat right in the belly. Really convenient, excellent way to do it. Less pain as far as an intramuscular shot is concerned, and it keeps the levels consistent because we do shots twice a week versus once. And some other nuances that we're doing to really keep the levels consistent even with an injection. So another great opportunity for
And there's
that.
no downtime.
No downtime.
And I would like to say that when we talk about testosterone, we are talking about testosterone for men and for women.
Oh, yeah.
Really important for us to understand that. I know that there is perhaps some myths out there that testosterone for women is not necessary, especially once you're past your reproductive years. And I'd like to say that you should definitely fight against that machine, because that's definitely not true. We need that testosterone. We need that libido, that sexual desire, but also our libido, again, going back to that phrase that I know I use a lot, is fervor for life. Testosterone helps drive that.
Yeah.
And it's one of the most important hormones for anxiety and depression management, which is important because I do think peri and postmenopausal women tend to be probably maybe misdiagnosed or at least mistreated, in our opinion, where they're put on anti-anxiety or antidepressant medicines, and maybe what they just have is a testosterone deficiency.
Yeah. I think in some cases where those medications might be necessary depending on the patient, but sometimes patients don't actually have a Prozac deficiency. There's no such thing. But there is such thing as a testosterone deficiency even for women. And here's the thing about testosterone. Women actually have about 10 times more testosterone in their body than they do estrogen. This is a common fact that most people don't realize. So women need testosterone for the same exact reasons as men do. Yeah. Guys just need more of it.
Yeah. And it's a preventive hormone, so prevention of things like osteoporosis. It's definitely involved in cardiovascular health. Diabetes. Again, this is men and women. So we can probably do 12 episodes just on the importance of testosterone.
Yeah, let's move on.
Right.
All right. So So that's sex hormone balance, and we can help with that, and we'll be getting into a lot of those things in future episodes. So another thing, a huge passion for us, is thyroid balance. I always say that I didn't go to thyroid. Thyroid came to me, and to Dr. Bosch, to Christina, and we realized that a lot of people are having a lot of issues with thyroid, and they just weren't getting the answers that they needed and deserved. So over the years, we've developed our unique system called Thyrazone. And by the way, we've got a book coming out in about another month or so. Look for it. It's called Thyrazone.
Thyrazone.
And where we go into that book in a very concise way and talk about our unique system with thyroid. And here's the thing with thyroid. That winds up having all kinds of problems because thyroid hormone affects every single cell in your body, head to toe, inside and out. So pick a problem, pick a symptom, pick a tissue. It's kind of affecting that. So whether that's fatigue, hair loss, constipation, dry skin, dry eyes, these can be related to low thyroid. So we want to be able to come in and offer not only just a good diagnosis, but a really unique, natural way of treating the situation with natural forms of thyroid hormone.
Well, and let's take a moment to talk about why it's unique. I think that the most important piece is the diagnosis. Many patients come to us, they were already suspicious based on what they have learned or read on their own that their thyroid is perhaps not functioning well. And kind of like John said, it really is the master of metabolism. I'd like to blame everything on the thyroid first until proven innocent, or in some cases, once you've got that thyroid really well managed, perhaps there are other symptoms that come up or the diagnoses need to be discovered. But what's so unique about the Thyrazone is how thorough we are in diagnosing it. We use tools other than just your blood work or the TSH, which many of you may have already had checked. So we really encourage you to ask your questions about what that means. We've already written a bunch about it. Look up the Thyrazone. It'll be out in about a month. And that'll give more detail on how to guide the conversation for you and your physician. If you're not available to meet with us, we're just going to help you get the answers that you're looking for.
Yeah, that's what we're about. We're about answers, and we're about solutions, and we're about results. So what else? Aside from thyroid, we also deal with insulin blood sugar control. Look, 86 million people in the United States have some form of pre-diabetes. But the frightening thing to me is that 9 out of 10 don't even know they have it. So we're having this sort of epidemic of obesity and pre-diabetes leading into diabetes. So many people are walking around with it. So that's a hormonal issue, and we offer solutions for that as well.
Yeah, and this is always a very important subject for me. Partly because I've always enjoyed working with women predominantly, and I especially enjoy working with moms. The reality is that moms tend to be the decision makers of what the family is eating. And it is all those pre-diabetic moms that aren't even aware that the food choices that they think are healthy for their family are not, that the food pyramid we grew up relying on is not for most of us the right choice. So learning a little bit more about whether you do have insulin resistance and how that will affect not only your health as mom and dad, but also future generations, that's one of the most passionate pieces that I can work on with you.
Sometimes I struggle because when I'm watching her, she's so beautiful to me that I get distracted, and so I'm getting distracted a little bit while we're doing this. So I'm doing my best. I'm doing my best. I'm going to move on.
All right, let's do that.
So, like really. Anyway, longevity medicine. This is a big thing too. So it's longevity, regenerative, and restorative medicine that we're focusing on here. Maybe you've heard of the term anti-aging. So we do have that focus, and part of that focus is growth hormone optimization. Sometimes people do need actual growth hormone. I think in our practice we tend to see people that are well into their 60s or 70s before they really need to start needing actual growth hormone replacement. But we can see suboptimal forms or levels of thyroid hormone. We can influence that through natural ways and through some really cutting edge stuff called peptide therapy. And yeah, these are precursors that tell the pituitary to make more growth hormone. And the side effect profile to this is extremely low, and practically none. And we're able to optimize these levels of growth hormone, which helps with all kinds of things. And that's probably one of the best anti-aging or longevity hormones that we have. So that would be another thing.
The more we can do to help supply your body with the, let's say, ingredients that it needs to better function on its own, that's definitely going to be our primary goal, or I should say maybe our primary intervention. Ultimately, we are looking at blood analyses and salivary and urine, all of that cutting edge medical tools that we have at our disposal. We're using them for you, but we never take away the emphasis of the subjective account of you as the patient. How do you feel? That really helps shape and guide, and again, bring that unique avenue to what it is that we're doing.
Medicine is definitely an art, just as much as it is a science,
sure.
and part of that is to work with relationships and establishing intimate relationships with patients to where they feel comfortable to be able to tell us exactly how they're feeling, and we use that as that guide along with everything at our disposal. It's all in the event or the need to be able to help and serve you. So what else we got? We talk about brain health here as well. Seeing early levels of age-related cognitive decline, and certainly in people once they get over 50, but even earlier and earlier we're seeing these issues.
For sure, earlier.
Right.
Foggy brain, or walking through molasses, or all of those expressions that we hear where the person just says, I'm just not quite as sharp as I'd like to be. I'm just not quite as sharp as I think I should be. Those are very valid and legitimate concerns, and fatigue may be the cause, but then why are you fatigued? Or are you disproportionately symptomatic to the realities of your life and your demands?
There's different theories of aging, and one of the key ones is about brain health. So the brain goes, so the aging process goes, and the body will follow. So we're looking to optimize that not only for immediate quality of life, but again for longevity. So from a restorative standpoint, we're also focusing on your adrenals. These are small little glands that sit on top of your kidneys. They secrete adrenaline, hence the name adrenals, but they also secrete other hormones like cortisol, DHEA. So we have really unique ways of looking at the balance with that, and that has a lot to do, by the way, with your stress.
Yeah, for sure. Or stress management.
Stress management.
The stressors are always there. It's the tools with which you maneuver through life that I think really impact your health positively or not so much.
Yeah, we respect the fact that people are going to be in the midst of stress.
Right.
I think, at least for me personally, I used to tell people, well, just take a vacation and, that will solve it. And that's just not practical in any way. So very early on, we realized that we needed to work with people in a way to be able to manage them through stress that is inevitable. So we want to make sure that we're keeping our minds open to serving you in that way. We also focus inevitably on immune modulation as well. A lot of times people have issues with their immune system, and that relates to some kind of hormone imbalance or an adrenal imbalance.
So this is a long list of hormone systems and perhaps some catchphrases of symptoms that are resonating with you. And I think the really important thing to do when you're listening to us talk about these lists, especially if they're words you're not familiar with, is to keep in mind that the entire body, it's connected. You're not a gynecology and a urology and a psychiatry patient. You're one human being functioning in a very sophisticated way. The body is super smart. It's usually providing us with the clues on what's going on. We just need to be really good listeners, and then we need to be patient, working again with your symptoms, with the labs, with our clinical intuition, and figuring out how to best serve you.
Absolutely. That's very well said. So what else do we have here?
Beauty. So the aesthetics component.
The aesthetic components
Let's hear it from a guy. I love this part.
Soften your lines, not your edge.
Not your edge. Very good.
So here at the dermazone, so we've got the hormone zone, and the dermazone is just powered by and inspired by the hormone zone. So the dermazone is our unique approach to aesthetics for men and women. And it's really cool because we have our tagline is noticeably natural. And because we're both naturopathic physicians, we respect that idea of moving into an aesthetic realm as naturally as possible for the sake of the patient, and maybe from a more subtle standpoint too, depending on what the patient's needs are. Every patient is different on what they're going to interpret. I suppose beauty's in the eye. So we're going to go at whatever pace or what somebody wants, but we're coming from that angle. And that really is what separates us out from a lot of other people doing aesthetics, because we're looking at this from a hormonal standpoint. We're helping the skin from a hormonal standpoint, internally primarily. We're looking at nutrition, we're looking at weight loss. All these things are going to help with beauty and longevity in that standpoint. And then even as we start to apply those aesthetic principles aesthetic tools, we're looking at that from a natural standpoint.
So we'll still be able to complement them with some of the more well-known aesthetic tools like the injection therapy and the fillers and PRP, which is something we love and we'll talk about, I'm sure, in another segment.
Yeah, well, we could maybe talk about it, and maybe we could end up talking a little bit about that.
Great,
So,
let's do that.
PRP, platelet-rich plasma. We take your blood, we spin it down. There's a small little portion of red blood cells, and it separates out from the platelet-rich, the nutrient-rich, the plasma-rich, platelet-rich plasma. And we inject that back into the body. And we can do this into the face, but we can also do this in a lot of other places.
We can. So what John is also coyishly insinuating here is that you can use PRP injections not just for beauty enhancement on the face or areas that you can see like stretch marks or even on breast for a breast lift, so to say, but you can use it in your more intimate areas. It's a wonderful therapy for injecting for both men and women into the clitoris, into the anterior aspect of the vaginal wall, into the penis. And what is this good for? Why would people be injecting that liquid gold of healing into their private parts?
For orgasms.
Of course. Why else? Well, no. Yes, there are other reasons.
There's other reasons.
But orgasm is definitely part of it.
Big one. Yeah, so the O-Shot, developed by Dr. Charles Runnels out of Alabama. It's been done for the past 6 or 7 years by Dr. Runnels, and so we are part of this very large group now where over 20,000 procedures have been done. And this is a wonderful, enhanced way to improve orgasm for women, sensation. It's helping with incontinence for women as well, because where the anterior wall, she was saying, it's just underneath the urethra. So coughing, laughing, sneezing, jumping rope. Yes. This can actually help with that because it starts to regenerate the area all in a natural way. This PRP is 100% natural because it's just you. It's you being injected back into you in a concentrated way to bring those growth factors in to be able to help, again, with orgasm. For men, same thing. This is helping with erectile dysfunction. And guys also get the bonus of size. So the PRP will actually bring about 10 to 20% of both length and girth for men. And this, of course, is helping just with the overall sexual experience.
For men and women.
Yeah, for men and women.
And I think, let's talk about this real for a moment. We're talking about sexual health. We're talking about the quality of your sexual experience. And I think it is incredibly minimizing to our libido if you're a man, I imagine, and you have concerns about your erectile strength.
Yes.
That's very discouraging. And for women, if you have had laxity that's age-related or childbirth-related, this PRP, again, liquid gold, this is your own healing power. It's concentrated, re-injected back into you. What's the risk factor?
The risk factors are very, very minimal. There can be some bruising and things like that. But as far as like a reaction to your own blood, it pretty much doesn't exist. PRP has been used in orthopedic settings for over 20 years with no signs of rejection in any way. It's been countless times. So it's a really excellent way to go about doing it. It's something we do offer here. It's something that's very personal for us to be able to offer this to people. It's a very sort of intimate kind of thing. And it's what people need in a lot of cases. So we start off with hormones. A lot of times it's amazing what that can fix, whether it's erectile dysfunction, whether it's incontinence, orgasm, whatever. But sometimes we need to take it to the next level. And because we innovate so much here at the Hormone Zone, we're constantly looking to take it to the next level for you. So
let's summarize.
That's that. Well, that is the summary. Look, here's what we definitely know for sure.
Hormones are sexy.
Look, life is sexy.
And we're here to help make you sexy.
We're the Sex Docs. We're here for you every Tuesday at 12:30 Arizona time. Really excited about our next topic, which will be episode 2, the sex hormone revolution. Getting hormone balanced for men and women. We're going to get into a lot more detail about the specifics behind testosterone and estrogen replacement therapy for men and women. We'll see you next
Tuesday.
Next Tuesday.
Thanks for joining us. Take care. Have a wonderful day.
Bye.
Bye-bye.